Hi everyone, we're going to be doing neuromodulator injection to the forehead, the glabella, the masseters. Then we're going to do a non-surgical rhino. Come over here, let me show you what we're going to do. And when we look at her nose closely, she's a nice, beautiful person. She has a polybeak. A polybeak deformity, it's a bad word, I didn't make it up, is where the nose has a hump and the tip here is low and the peak of the nose is higher up than the tip. It's a polybeak. Normally the tip should be the highest part of the nose. When the tip is low and the most prominent part of the nose is higher up, it's called a polybeak. I have that, I live with that every day. So what we're going to do is we're going to lift the nose up, give her a straight bridge, and we're going to enhance her features. Now when we look at her face, we measure the vertical thirds. From the forehead to the glabella, from the glabella to the subnasal below the nose, from below the nose to the pagonian, the most anterior part of the chin. When we measure the vertical thirds, right, as Da Vinci depicted, the lower third is less than the mid and upper. So in this case, we're going to add some chin filler to balance out the face. When you create proportions, you create harmony. When you create harmony, you enhance beauty. Friends, now we're going to start with her forehead. So Sam is somewhat Asian, so we got to be a little bit careful in that we don't inject too high. Because if we inject too high, what happens is she can drop. So I'm doing a classic V pattern. And now we'll go ahead and inject her glabella. Scowl. So we're going to get rid of that. Relax. We'll work on 3. 1, 2, 3. Into the procerus muscle. Then we do the corrugator on this side and the corrugator here. And these muscles cause those 11 lines. Now they're going to be gone. The next thing we're going to do is we're going to relax her masseter muscles to give facial slimming. And so if you come over here, go ahead and give me a big strong bite. Look there. Relax, big bite. See that bulge? That's the masseter muscle. It attaches from the zygoma down to the angle or the corner of the jaw. We put our fingers on each side, have her bite, relax, bite. Look at that. 1, 2, 3, bite. Keep holding it, poke. We go into the meat of the muscle. You can see the muscle, just like the textbook, like that. And on the other side, now go, watch this. Go ahead and bite, relax, bite, hold it. See that muscle? We're going to make that muscle go down. Thank you. Right, now comes the real exciting part, the non-surgical liner. Now, when we look at her nose closely, now you have to understand anatomy. You have to understand physiology. When we look at her nose, she has a bony dorsal hump. She has a polybeak, or her tip is low, and it's not straight. So what we're going to do is we're going to lift the tip first and set the tip, and then we'll make the hump go away. We're going to make the hump go away by injecting the radix, or the root of the nose, and the super tip area to make it nice and straight. We'll go like this, with a little curve and down. Okay. So first step, lift the tip. Why? This area is easy to set because we're putting the product on bone. So I have a scaffold. There's no scaffold here. So I really don't know exactly how much I'll get here. So I'll set the tip first, know my base level, and then I'll lift everything around it because this is more predictable than here. Makes sense. So to lift the tip, first we're going to create the shape we want. I pinch the tip and lift it off the skin, off the cartilage. Then I'll take my needle and I'll gently go in above the cartilage, below the dermis of the skin. I'll pull back to measure out in the blood vessel. See that air? That's a good sign. And now what we see is her tip is getting higher and higher. Now you see, if you come from the profile, her tip is the most projected part of her nose. Now we're going to add a little bit more. We're going to let the skin stretch, but that's coming out perfectly. I'm going to balance the tip, so we're going to lift it up here. Go a little bit on this side, pull back. Make sure we're in the right area, which we are. Beautiful. Now we look at the nose, we see the tip, but the dorsal convexity or dorsal hump is still bothering us. Don't worry, just stay tuned. We do one thing at a time. Now her tip is up. It's a nice round button tip. You doing okay, Sam? Mm-hmm. Okay, we're gonna go ahead and make the hump less noticeable. The reason she has the hump is because she has a lower radix. You have to identify that. If you think the reason she has the hump is because the super tip is too low, this area, you're doing it wrong. Set the radix, work your way down. What we're going to do is we're going to go in here in the root of the nose. 1, 2, 3 big blood vessels that we're going to avoid. We're going to gently pull back to make sure we're not in a vessel. Fantastic. Now we're gently going to put product here. And when we look at Sam's face, she has a nice, strong, bony face, but she doesn't, her soft tissues are less. So by enhancing the soft tissues, we make her face more in harmony. If you guys can see, the hump is literally going away in front of you. Again, we're going to go right there. We're going to inject, right out, inject. And you see how the hump is going away in front of you. Step by step, region by region. See how the nose is becoming nice and straight? The whole nose is being lifted up. Looks really, really nice. Pull back, safe. Inject a little bit more. A lot of new injectors, you know, they'll do one side and they'll look at it and they'll be like cute and the patient's excited and they're excited, and they'll let it go. You can't do that. You gotta look at it from every angle and make sure you've sculpted this to perfection. Now when I look from this side, there's a slight 1 millimeter indentation there. We're gonna make that go away. Give me a fresh needle, please. Now you saw I made the bump go away by injecting up top, not on the below. So you have to understand the anatomy and physiology of the nose to really change it. Looks very different in a good way, Sam. A little indent right here. Remember, if you're not your own critic, the patient's gonna be. You have to look at this. Wow, look at that beautiful line, look at that. That's called the brow tip aesthetic line. It's a line that goes from the eyebrow to the tip. It should be a nice, smooth line that comes up like this. The line goes across the brow, down and up, and we created it. Before it was this, and this. But now it's nice and straight. Wow. Now we'll go ahead and do her chin filler. When we look at Sam's chin, she doesn't have enough projection, in my opinion. I think it's perfect how she is. She's perfect how she is, but she asked us to analyze it, so the projection is low. We're going to do a single point injection. Put your finger below the chin to stop the filler migrating down. Look at the midline. Look at the midline. Look at the midline. Straight in, on the bone. Why didn't I pull back here? What are you doing, doctor? Are you being reckless? Absolutely not. I know there's no real blood vessels in the middle. I'm safe. In areas where I might not be safe, I have to be more judicious. In other areas, I'm still judicious, but I do the technique that's needed and I minimize trauma to the tissue. If you do the same thing everywhere, and the only tool you have is a hammer and everything is a nail, you're gonna get right 80% of the time. 80 is not good enough for me. I want 100.